Hey, everybody. I'm sure missing you all, especially not being able to have you in the classroom when I teach. So, to try and make this as interactive as possible, I'm going to ask you to please get a piece of paper or a few pieces of paper and a pen. And at various times during this lecture, I'm going to ask you to pause the video and write down your answer. And then when you resume, you can see how well you did. So today we're going to talk about transboundary diseases. My background, I think a lot of you know, but I grew up in the city. I didn't do a lot of traveling at all. In fact, I didn't get a passport until I was 31 years old for my first international travel experience. And that was, I was out of vet school. I was actually in a faculty position and I got invited to present some research results in England. So the funny thing that happened when I started traveling internationally is every time that I would travel, there would be some kind of a major disease outbreak. It's a little unfortunate. I did not cause these outbreaks, but that's just how it turned out. So my first global experience was to Birmingham, England in 1998, because yes, I'm old. And at that point, they had banned the sale of beef on the bone. So this is where Birmingham is. And I would like you to pause now, and you can Google it or see if you can remember what happened in 1998. What disease were we concerned about? Okay, this was bovine spongiform encephalitis, or mad cow disease. And at the time, when I was in England, they were saying that they were concerned that people could contract BSE from eating beef. And I didn't believe it at all because all of the other prion diseases didn't have that type of transmission. So while I was in England, I ate about as much beef as I could find. And some of the menus said it was coming from Australia, some locally sourced under the table. And then after I got back, it was like about a few months later, there was this great article that came out that said, indeed, people could get it from beef. But I think I'm okay. I'll let you decide. This was pretty rough, though, in terms of the veterinary industry. It was just heart-wrenching for producers because they were not allowed to sell their cattle, and then there was the fear of them contracting the disease. A lot of producers went out of business, and with that, a lot of veterinarians whose sole focus was to serve those producers took a big hit. There was just a huge crisis abroad. And then when BSE hit in England, beef consumption in the United States also dropped dramatically. So we saw an impact on our industry here. Okay, my next trip. This one was kind of weird. I got an email asking me to go to Italy and speak. And the place that was in the email, I couldn't find on the map. And I still have trouble finding it on the map. When you're a hog vet, you don't get invited to big, exciting places usually. So anyway, I get invited to Italy to talk about erysipelas, which is a bacterial disease that can cause septicemia in pigs. And I'm kind of excited, kind of a big adventure to be going someplace that you can't even find. I did check up on the people that invited me, and they were legitimate veterinarians in a community. So I figured, why not? I'll go for it. But at the time, there was another disease outbreak that people were actually concerned about flying, especially international flights. And Drs. Ragland and Dr. Hill really didn't want me to go. They were concerned for my safety, but I thought, I'll be okay, I'll go. So I want you to pause again and see if you can find out what was happening in 1999 that would cause concern for international travelers. Okay, the hint is the organism pictured on the right, and I can say it caused respiratory problems. Uh, in fact, when I got on the plane, a gentleman that was sitting near me started coughing, and he must have had the same flights that I had because he coughed all the way to Amsterdam with me, and then he sat in the part of the airport where I was waiting for a layover, and then we had another layover in Italy in a very small airport, and he was also in that area waiting, and it turned out he was on the very small plane going to this very small town in Italy. And then we arrived, and it turned out we were going to the same place. He was the other keynote speaker for this veterinary conference. But the disease of concern was multi-drug resistant tuberculosis. There was a huge outbreak in Europe, and it was actually going through at the time the Russian prison system. And a lot of people were being released and traveling to different countries to get out of that area. So that's why international travel was a concern. So much so that CDC, the Centers for Disease Control and Prevention, put out this little memo about the risk of acquiring tuberculosis on an airplane. And they pretty much said if your flight lasted 8 hours or longer, you were at a greater risk than people on a shorter flight. My flight actually did last a little longer than 8 hours, but again, I was fine. Then 2003, Ontario, Canada, I get invited to give a talk about my research in swine biosecurity, and I land in the Toronto airport, and this is pretty much what I see. This isn't my image, but this reflects what I saw. So pause again. What was happening in 2003? Yes, this was SARS #1. There was a big outbreak in Canada when I had landed, and I actually drove to the conference site, and the speaker before me had just come from Vietnam. He actually had come from where case 0 was of SARS. And he did want to use his laptop computer for the presentation, but I declined. I said I would prefer to use my own. Again, this was pretty troubling. A lot of unknowns here, but we did get through this outbreak of #1, just like we will get through the current outbreak. So biosecurity policies. This is what I did for many, many years, working with animal preparedness on prevention of transmission of infectious disease, and then working in the human world, primarily preventing and training for outbreaks of pandemic influenza. So what are biosecurity goals? So you have twofold goals. You want to keep disease out. So diseases like foot and mouth disease that aren't in our country, we want to keep them out. And if you have an outbreak, you want to contain it so it doesn't spread. So keeping disease out, keeping disease in are the major goals for biosecurity. In Indiana, if you just look at our state, we have a lot at stake. So we have almost 23,000 farms producing livestock. These are 2012 numbers. We've increased a little bit, but our products are valued at $3.68 billion. So an outbreak of any disease is quite devastating. And we've seen this with some influenza outbreaks recently in the poultry industry. There's a unit in Texas, the National Center for Foreign Animal and Zoonotic Diseases, and they predicted that a single undetected outbreak of foot and mouth disease could cost the United States $2.3 million per hour. Think about that. Usually takes about 2 weeks to detect a new disease because it's subclinical before you see those first clinical signs, and then someone has to recognize it, and then you have to test and get a positive. So typically when we look at outbreaks all over the world, foot and mouth disease and others, they've usually been circulating for at least 2 weeks before somebody realizes it. And the other reason why this is important, you are living right now. This is the map as of 2 days ago of where all the cases are for our new SARS. And 75% indicates that 75% of emerging diseases in human beings, so new diseases in human beings, originate in animals. And that's why you have such a critical role in preventing these incidences in the future, 75%. And for coronavirus, they typically originate in bats, and that's what the current hypothesis is for our new SARS. So today, we are going to talk about what you might see when you go traveling again, when that is allowed. We're going to look at some clinical signs, lesions, and how these diseases are transmitted, talk about biosecurity, and then we'll summarize with some take-home messages. And we're going to start by looking at a few diseases that aren't always in the United States or rarely in the United States. When you get ready to study abroad, if you're excited about things that you might see, you can go to this website. It's the World Animal Health Organization. And if you go on the website, you click where it's circled here, this WAHIS portal. And then you click on information by country or territory. And then animal health situation. And you'll get these cool maps. So this is for China. You get to pick the year. And it will tell you all of the diseases that are notifiable and all the diseases that are not notifiable and where those diseases are currently located. You can also drill down and see when the last outbreak of those diseases was. Okay, we're gonna start. This is your first case. First thing is, what is the species? Write down on your paper. What type of animal is it? And then I want you to write what you see that is wrong with this animal. So pause, write down species, and what's wrong with the animal. And then for bonus, you can write, what do you think this animal has? Okay, here we have a rabbit, and this rabbit isn't doing so well. It looks like the face is pretty swollen. And this is Myxomatosis, and this is a reportable disease in the United States. It's caused by a pox virus. Thankfully, it's not zoonotic, so it cannot be transmitted to people. And you can see swelling of the front and back of the rabbit. So eyes, ears, the face as a whole, genitalia, and the anus. You can see lots of oculonasal discharge, and these rabbits typically have a fever and can be fatal. It usually is fatal. And right now, you can see this disease if you travel to the Czech Republic. Myxomatosis is resistant to disinfectants. It's transmitted primarily by blood-sucking insects, so your fleas, your mosquitoes. It can also be transmitted by fomites, which are inanimate objects like clothing, dishes. And when I was little, when you traveled, souvenir that they sold for good luck was rabbit's feet. And they would have little keychains and they dyed them pretty colors. And like looking back, it seems a little horrific that that's what you brought home for your kid for a present. But they were supposed to be good luck. Probably not good luck for that rabbit though. All right, next. What is the animal? This should be pretty easy right now because we just reviewed it. And what do you notice is wrong with this animal? And what do you think it has? All right, here we have a rabbit. And this rabbit has blood coming out of its nose, or epistaxis would be the term you would use in pathology. This is rabbit hemorrhagic disease. It's caused by a Bovine virus, and it can show lots of different signs. You can get neurologic signs. These rabbits can convulse. You can get respiratory signs. They can be dyspneic, so having trouble breathing, and you can see this frothy or bloody nasal discharge. Because they are losing blood and oxygen, you can see cyanosis or bluing of the mucous membranes or yellowing, the jaundice. These rabbits can die suddenly, and on necropsy, you can see an enlarged spleen and necrotic livers. You'll also see some pulmonary edema, so lots of fluid in the lungs, and then hemorrhages throughout. This is resistant to inactivation, so it's spread a lot by fomites. It can also be transmitted through meat or hair from the infected animal, flies and other insects, but it's primarily spread by other infected rabbits. We can find this disease now in the Czech Republic and Switzerland. And in 2005, there was an outbreak in another location. There was actually an outbreak right here in Indiana, and our veterinarians at the Indiana State Board of Animal Health were involved in containing and tracing out this outbreak. Okay, next case. Again, you know the drill. Pause and write what is the animal and what signs are you seeing and what disease do you think this is? Okay, we switched it up a bit. This is a horse. This horse isn't doing too well. This horse has froth coming out of its nose, quite a lot of froth. And this is African horse sickness. This is caused by another virus, an orbovirus. It infects all sorts of equidae, so horses, mules, donkey, and zebra. You can see swelling here around the fossa. The eyelids will be swollen and pretty much the whole face and down to the brisket and shoulders. This is fatal. This picture here is of the respiratory form. These horses will be febrile, have trouble breathing, of course. They'll be coughing, and you can see this frothy fluid and conjunctivitis. And the cardiac form also causes trouble breathing. On necropsy, you'll see pulmonary edema. So this is the lungs. You can see they're kind of angry. They're very red instead of pink. You can see some hemorrhages here. And you can see that the lung lobes are spread apart quite a bit. So this is fluid in the lungs, and this is pulmonary edema. And then this is a photograph of the GI cavity, the abdominal cavity, and you can see there's a lot of fluid here as well. Also, in the thoracic cavity, you might see fluid around the heart. And again, hemorrhages throughout. African horse sickness is spread by mosquitoes, ticks, and biting flies. It's not contagious by contact, but you don't want to bring home a vector. You don't want to bring home any of these biting insects. So Mozambique and Ethiopia are where you can see it right now. Next case. Animal, what you notice, And what do you think it has? Pause, please. Okay, my favorite, this is a hog. You can see this is the ear, and we have cyanosis of the ear. And then this is the liver, and this is the gallbladder. And there is edema of the gallbladder. Whenever you see edema of the gallbladder in swine, there's usually something big going on. I learned this firsthand when I was in practice. I brought in a sow who had died suddenly and took her to the diagnostic lab. And they were doing the necropsy, and all of a sudden they're calling everybody over, and everyone's surrounding this animal because they had gallbladder edema. So I learned that that was a pretty significant sign. And it's significant because it can be a lesion associated with African swine fever and some other pretty significant diseases. So right now, for the past couple of years, African swine fever, it was kind of in the #1 place for concern before COVID-19 in China. And we've had huge outbreaks. In fact, China's lost a large number of their hogs. The number of animals that have died in China from African swine fever have exceeded the entire annual production of pork in the United States, to give you a picture of that. So this is another virus, just infects swine, causes a fever. You can see cyanosis and necrosis of the extremities. You might see bloody diarrhea, some reproductive impacts. Death loss is 100%. There's no vaccine right now in the United States, and this is not in the United States right now. We want to keep it that way. You can see pericarditis, some adhesions in the lungs, swollen joints, hemorrhages. This is some splenomegaly, gallbladder edema, as we talked about, and here's a hemorrhagic lymph node. So again, gallbladder edema. The other thing that people will talk about are turkey egg kidneys, and that's a big indication of something scary might be going on in pigs. And here's a kidney, and you can see they're very small hemorrhages. These are petechial hemorrhages. And everyone in vet college always told me they were turkey egg kidneys, and that didn't work for me because I had no context. I'd never seen a turkey egg. So here's a turkey egg, and you can see how they have tiny red spots, much like these petechial hemorrhages in the kidneys. Another thing that's unique about African swine fever is you can see infarcts in the skin. So here is a good example of that. The African swine fever can live for long periods in blood, tissues, uncooked or undercooked pork products, 6 months. So it's important to cook your pork well. It can multiply in vectors like ticks. It can be directly transmitted or indirectly transmitted through garbage feeding. And that's why we're pretty strict in the US that either garbage feeding is prohibited or it must be cooked. It can be spread through fomites, and right now you can see it throughout Africa, the Ukraine, and Poland. Dr. Ragland is actually working on helping producers in other countries control African swine fever. Okay, here's another one. I hope you've got the pig. What do you see? And what do you think it is? Okay, we have our pig. We have some cyanotic extremities here. We've got a big case of conjunctivitis. And then we also have these turkey egg kidneys, these petechial hemorrhages on the kidneys. This is classical swine fever. It used to formerly be known as hog cholera. And this looks pretty much indistinguishable from African swine fever. So you really need diagnostic tests here. It's caused by a different virus, though, a pestivirus. These pigs just don't look well. They'll arch their backs. They have conjunctivitis, which was new in the early 2000s. Previous to that, we did not see conjunctivitis in classical swine fever. And some outbreaks were actually missed because the pigs showed conjunctivitis, and we never thought that that was a clinical sign. But since then, we know that that's a big clinical sign. You can see CNS signs, fever, and you can see these abscesses in the tonsils. So this is the tonsil of a pig, and here's an abscess. And this is actually the sample of choice. If you're trying to diagnose classical swine fever, you want to make sure you get tonsil. We have some more lesions here, the turkey egg kidneys, we have some splenic infarcts, and we have hemorrhagic lymph nodes as well. Classical swine fever virus can survive in cured meat or smoked meat. Again, can be spread by fomites. That's why we don't want garbage feeding. And it can also be spread by direct contact. Right now it's in Ecuador, Cambodia, and Vietnam. Okay, since we don't have the rest of the animal, I'm going to tell you it's bovine. I want you to guess at what organ this is and what you think it is. All right, this is a lung. This is a picture of bovine tuberculosis. In this case, it's caused by Mycobacterium bovis. This is zoonotic, so we can get this too. And these animals have fever, an intermittent hacking cough, diarrhea, and swollen lymph nodes. This is a lymph node that's been cut into, and you can see the inspissated pus. You can get TB through direct contact or inhaling infected droplets or ingesting raw milk from infected cows. So that's why it's really important when you're traveling abroad to politely decline raw milk. You do not want to end up with TB. And these are the countries where you can find TB currently. Every once in a while, we will get cases in the US. Okay, again, I'm going to give you the species for this. This is a caribou. We got something going on here. And then this is a sheep. This is a male sheep, ram. What do you think's going on? Guess the disease. Okay, this is brucellosis. Okay, you can find brucellosis in multiple species, right? Cattle, swine, small ruminants, camels, equidae, dogs, marine mammals even, and us. Brucellosis typically causes abortion in females. It can cause an undulating fever. So you get a fever, then you don't, then you get your fever again. It causes lots of discharges, swollen testicles, and joint problems. You get lots of arthritis, and in horses you can get polyebal or fistulous withers. Here's some hemorrhagic cotyledons in a placenta. You can get brucellosis again from drinking raw milk, so not recommended. Contact with fomites, especially if the organism contacts open cuts on your hands or any part of your body or your mucous membranes. Contact with abortions or the aborted fetus or birth fluids also can cause this. So you want to make sure whenever you are handling a reproductive case that you do wear gloves. And brucellosis can survive in the environment for many months. And this is where countries that are currently have it. Okay, species, what do you notice? This one's a little tricky. Okay, this was a sheep, and this is Bluetongue. This is caused by an orbovirus. It only impacts ruminants. It's not zoonotic. There's no direct transmission. The Culicordes biting midges are what spread it. It's fatal. These animals don't do well. They're losing weight. They have fevers. They have hemorrhages and ulcerations around the mouth and nose and swelling. So, of course, they don't want to eat. And it gets its name because they get a cyanotic tongue. You can also see some lameness with this and other clinical signs as well as wool loss. And again, this is primarily spread by biting vectors, so you don't want to bring back vectors. These are countries where it is right now, and I'll talk about not bringing back vectors. That can be in things that you bring back or on the plane. I don't know if any of you who have traveled internationally have, once you're in the plane, experienced the plane being sprayed. And that is to kill any vectors that might be on that plane that could transmit diseases. Insect vectors, not people vectors. Okay, what's going on with this chicken? And what do you think is the problem? This is Newcastle disease. It's caused by a Paramyxo virus. It infects birds. It is zoonotic, although it's pretty mild in people. You might get a mild conjunctivitis or very mild respiratory disease. In birds, however, respiratory disease is quite common, and you can also get neurologic or GI signs, and they get this swollen blue head and neck. You might also see hemorrhages, an enlarged spleen, and that pulmonary edema. So here's the swollen comb. It can be spread through direct contact with secretions and excretions of infected birds or contact with fomites. And this can survive for weeks in the environment. Here's another one with a swollen head and comb and wattles. This looks just like exotic Newcastle disease, but this is high-path avian influenza. So this is an orthomyxovirus. It affects mainly birds, but you can also see it in dogs, cats, horses, people, seals, whales, pigs. You know, flu hits everything pretty much. Except for cows. We don't see it in cattle. You can see respiratory signs, so these oculonasal discharges, coughing, dyspnea, prominent swollen head, cyanosis and swelling of the wattles and the comb, and you can also see neurologic and GI signs. High-path influenza causes very high amount of death loss, and you can see hemorrhages. Here are some hemorrhages. Spread by contact with infected birds, secretions and excretions, and through fomites and through eggs. And we experience it in the past few years. We've had quite a few outbreaks in the US that have been devastating. So we don't want to bring this one home or spread this when it happens here. Okay, hope you get the species right on this one. This is a disease we have in the US, primarily out west and in other countries. This is anthrax. So anthrax is caused by Bacillus anthracis. It produces spores, and the spores are how it's transmitted. So if you see an animal like this that is dead and bloated, you do not want to cut into it, because as soon as you cut into it, those spores are going to disseminate. It impacts mammals, usually ruminants and people, and you'll get these ulcers with dark centers on the skin. But there's all different forms of anthrax besides cutaneous anthrax. You can get inhalation anthrax and gastrointestinal anthrax from eating infected animals. You'll see a lot of unclotted blood, and there's a very high mortality, and these are intestines from an infected animal. It's, again, transmitted by spores that are extremely resistant. They can survive for many years in soil, on hides, wool, or hair. So that's why, like, green Drum covers, drum leathers that are made from green hides can transmit anthrax. You can get it through inhalation, ingestion, cuts, or even insect bites. So it's important to not eat animals that have been found dead. So if you're offered an animal that has been found dead, please decline. You can politely say maybe you're a vegetarian, or do something that's not insulting, but don't eat those animals. And again, don't open animals that appear to have died from anthrax. And the control measure is to burn or bury the carcasses. Okay, back to my favorite species and what's going on here. Okay, that was a vesicle that had ruptured on a pig. And we'll talk about vesicular diseases next. This is an outbreak of foot and mouth disease virus that was in Taiwan. So there's all different vesicular diseases. You can't tell them apart just by looking at the animal. So we have foot and mouth disease that can infect pigs, can infect ruminants, can even infect hedgehogs. That's why it's really important that if you have pet hedgehogs, you know the origin and they've had health certificates. Can also, excuse me, not cause disease in people. It's not considered a public health hazard, but it can infect people. The way that they found this out was some scientists grew up a bunch of foot and mouth disease in milk and drank it to see what would happen, and they got some blisters on their lips. So again, if you go pretty extreme, you can get infected, but it's not considered a public health hazard. Other vesicular diseases, swine vesicular disease, people and pigs, vesicular stomatitis, which we have outbreaks quite frequently of in the US, can affect multiple species. Vesicular exanthema of swine only infects pigs. So here are some pictures from my colleague in Hong Kong. These are the most beautiful pictures I'd ever seen of foot and mouth disease, and it can cause lameness. You can see these vesicles have ruptured. Typically, you see the vesicles starting on the coronary bands. You can also see these snout lesions, both unruptured vesicles and then ruptured vesicles. But again, you can't tell them apart. This is foot and mouth disease virus, this is vesicular stomatitis, and this is vesicular exanthema of swine. You can also see some tongue lesions, foot and mouth disease, swine vesicular disease. Transmissions, primarily contact with infected animals or animal products. This virus can survive an incredibly long time. Dried milk, 2 years. Can survive on fomites, and it's throughout much of the world. It's not in the United States or Canada or Antarctica. And then this was an emerging disease quite a few years ago. This is Nipah virus. It's caused by a paramyxovirus, and it originated in fruit bats. It can infect dogs, cats, horses, and goats, although when it first broke, when it first emerged, we saw all the cases in pigs and people who were raising pigs, and it was fatal. It was pretty scary because we didn't know what was causing the deaths, but we knew it was pigs and people with pigs. It turns out it originated in bats, and the virus survives in fruit bat urine, and the bats were urinating and contaminating fruit juice and water, and then people and pigs were drinking it. You can see respiratory and neurologic signs and hemorrhages in the lung and brain. And now we see cases every once in a while of Nipah virus. It's spread by direct contact with animals and that are infected and infected people. There was also some cases of it being spread by fomites. I remember early on, there was somebody who had left a farm in a truck and the tires had been contaminated. They got a flat tire and the individual who helped them change the tire ended up becoming infected. So again, when you're traveling, avoid contaminated fruit juice, contaminated water, and the most recent outbreak of Nipah involved contaminated date palm juice. So take homes when you are studying abroad, use personal protective equipment, and don't eat animals that were found dead. Don't drink raw milk. Now let's talk about what you do when you return home. So we have Custom and Border Protection. This is their 2016 daily take. They screened over 1 million people. They found over 4,000 materials to quarantine, 404 pests, and almost 8,000 pounds of drugs. And this is a member of the Beagle Brigade. We have over 1,400 canine teams and 400 horse patrols that serve our borders. And here's a little personal story. I was invited to give a talk or a few talks in Mexico to go for a few days. And this is where I ended up. The plane landed here, and then the second plane went here. And when I was on my way back, well, I guess I'll tell you a little story. In where I was going, there were lots of pork producers, and some of the pork producers were also, we'll say, in the pharmaceutical business. So I met lots of interesting people and had a pretty cool experience down there. And on the way home, I wanted to bring back a souvenir. So they had these little wooden animals in the airport. So I got a little wooden animal and I purchased it in the airport in Mexico, flew back to the United States, and was immediately greeted by an individual who worked for the government who had a lab. And I said, I didn't realize they let labs in the Beagle Brigade, because I was so used to USDA's Beagle Brigade. And she informed me that they were not the Beagle Brigade, they were DEA. And I was detained for about an hour, searched pretty significantly. And then I was released. And I didn't think much of it. And I went home and I took my little animal statue and I put it on, at the time we had a boa constrictor, and I put it on top of his enclosure. And a few days later, some white powder started coming out of the nice little animal statue, and it proceeded to disintegrate. And I was very concerned that I had muled some drugs. My husband immediately put it in a plastic bag, took it to his lab and put it in a biosafety hood to further evaluate. And he took it apart and found little tiny beetles inside this statue. So it was made of wood and the beetles were eating it, and the powder was a result of the beetles. So I did not mule drugs, but I did bring back a pest unintentionally from Mexico. So we fumigated it, we killed everything, and then got rid of it. So take home, for me, don't bring back some risky souvenirs. So no animals, animal products, samples from research projects, unless you have all of the appropriate permits and transport mechanism that has been approved. No hides or skin, no food. I don't even bring back my shoes. I just leave them in the country that I'm at, and wear new ones when you come home. Dirty clothes or supplies that contacted animals or animal products, blood, secretions, or excretions. Either launder them incredibly well, bleach them, or just leave them there. Please be honest on your customs form. The intent is to protect our country. Excuse me, and once you return, stay away from animals for 5 days. And again, it's inconvenient, I know, but the intent is to not spread a disease that you might know that you are carrying. Here's just a little news shot from a swine fever outbreak, a classical swine fever outbreak in England. This is how it was caused. Some tourists were hiking in the hills and there was a pig in the backyard. It was a pet pig. And they threw this pig part of their ham sandwich that they had been eating while they were hiking. They were finished, weren't hungry anymore. They threw it to the pig for a treat. And that ham had classical swine fever virus in it. That pig became infected and it sparked a huge outbreak in England. So little things can have big consequences. So remember, be observant. Diseases don't look the same in an immune population. So if we have a population that doesn't have any immunity, you can see pretty strong clinical signs. In a population where there are vaccines or acquired immunity, you might see a lot of mild clinical signs. So you might be dealing with an infected animal, but it won't seem dramatic to you. So protect yourself primarily and don't bring it home. And I wanted to end with a positive because this was my last international trip in Brisbane, Australia, in 2001, and there was no disease outbreak at all. And I got to play with the roos. So I want to credit a lot of colleagues for the wonderful pictures that they supplied. I hope you found this useful. Please let me know if you have any questions. Let Will know or email me and we'll get those answers. And if you would like to set up a live Q&A at any time, let us know too. I'm happy to do a WebEx or a Zoom where we can chat. Take care and stay safe.